Welcome to Field Notes, Insights from New to Public Health Alumni. New to Public Health is a year-long workforce training program for those who are new into the field of public health. I'm Juliana Mansky.
And I'm Mackenzie Legal. We are program facilitators and hosts of this podcast. With a vibrant community of over 400 current and past residents, New to Public Health is a wealth of knowledge and experience in the public health field.
In each episode, we'll share inspiring stories and valuable insights from those who've journeyed into public health, highlighting their unique path and the impact they're making. Joining us today is Tanya Bohacheff, Public Health Strategist from the North Shore Health Department in Wisconsin. Tanya graduated from the New to Public Health Residency Program in November 2022. Tanya, thanks so much for being here with us today. Would you tell us more about your story transitioning into public health from the business world?
Sure. Thank you for having me today. So I received my undergraduate degree in production and operations management, which is now known as supply chain and operations management. Not that long ago, but long enough ago that at the time, public health wasn't an undergraduate degree. I think if public health itself would have been an undergraduate degree here in Wisconsin at that time, I might have gone that route, but I didn't. I ended up in business and the pandemic had hit. And unfortunately, because of the pandemic, I did lose my job. And although for a very long time I enjoyed what I was doing, I was working in supply chain, logistics, continuous improvement, everything that you think of when you think of supply chain, it wasn't something that really excited me anymore. And so I started to look around and see, well, what would I want to do? And originally, I had started out going for microbiology before I moved to business. And I thought, going for microbiology wasn't the thing I was going to do, but public health was all around because it was the pandemic. And so I started exploring what opportunities existed for me and ended up getting my Master of Public Health in epidemiology with a little bit of program planning as well as community behavioral health and policy involved to kind of give me a well-rounded background. Started working at a local health department because I really wanted to see how the things were that I was doing in the classroom and how that translated into the real world. Started seeing a lot of opportunities for my business background. I know when I moved from business to public health, a lot of folks had asked, well, how do those two things connect with each other? And there's a lot of ways in which they connect. They connect through continuous improvement. They connect through organizing and managing, emergency preparedness and response, through efficiencies, through program planning. There are so many ways that I didn't realize when I entered this journey that they tied together that I now can see almost 5 years later. Some of the things that I do that tie both of my roles together include program planning and implementation. I do a lot of strategy focused on Public Health 3.0 as well as our academics, trying to focus on institutional collaborations, trying to identify efficiencies, where areas where we can improve upon, facilitation, budgeting, grant writing and planning, coordination of our CHA and our CHIP, and just so many things. There's really a strong relationship between the two that we just don't know until we start exploring it.
Yeah, absolutely. Definitely not that obvious linkage between the business world and public health sector in terms of like mission and vision, but as you've described, that day-to-day work, it does have a lot of overlap. You've given us a lot of example topic areas that overlap. Can you share maybe one or two of those examples and like the nitty gritty or how you're using those business skills in some of those public health areas now?
Sure. One of the things that I'm using is my data-driven analysis and skills that I developed when I was in business. So business is really statistical based, just like biostatistic is in public health. And one of the things I do is I collect data and use data to help make the decisions around our programs. How does it help our community? How does it help our residents? How does it help the health department? Are we having a successful outcome with it? Do we need to make tweaks? Without data, how do you know if a program is being successful or not? And collecting that data and using that data, using it, to analyze through Excel or through BI or other programs, even Tableau. Those are skills that I had coming over from business that I was able to integrate into public health. And it's really helped when we do the evaluation portion of our programs that we're trying to introduce into the health department. Another example was I have a background in Lean and Six Sigma methodologies, and I use those every day to help just try to pinpoint areas for operational management efficiencies, process improvements, like how can we do something better in the health department? And an example would be, how do we build collaborative relationships? That's a form of doing something better, where we can work with other organizations to perhaps bring something to the space that we don't offer, that together we could offer. An example being, we did flu clinics last year, and at the health department I work at, we only provide flu vaccine, but we partnered with a local pharmacy who could provide all of the other vaccines to our residents so they could get the vaccines that they wanted on top of the flu vaccine that we offered. So working together with each other through process improvements.
That is a great idea and such a simple yet powerful collaboration of building capacity for public health and bringing in those community partners like the pharmacy to offer all the vaccines. And what a great asset for the individuals coming as a one-stop shop instead of going all over the place, which is such a barrier to getting vaccines that I'm sure many of us, myself included, have experienced. So that is great to really intentionally think about that quality improvement and build that in on the day to day, like the intent of continuous quality improvement is meant to do. So, love that approach that you're bringing to the team. What advice or thoughts would you have for others, maybe think from the business world, thinking about transitioning into public health, or even just leaning into some of those traditional business approaches and building that into public health work?
Well, everything's connected. You can always find a case for how things can be weaved into each other and support each other. It might, on the surface, not seem like there's a connection, but if you look deep enough, you can find one. And when you take different areas of study and different professions and you bring them together, that really gives you the possibility of thinking outside the box. And that's one of the things that public health we're known for, is thinking outside the box. Like, how can we bring public health to the population? And that's something I feel the business, because of my background in continuous improvement with Lean and Six Sigma, has really helped me develop, is how do I think of these ideas and bring forth public health 3.0 or even public health 4.0 into the population. So my advice is really, everything's connected.
That is great advice, Tanya. Thank you so much for sharing a little bit of your story and your journey and the innovation that you are providing to the field of public health and at North Shore. And best of luck as you continue on.
Thank you for listening to Field Notes, Insights from New to Public Health Alumni. For more information, visit new2publichealth.wisc.edu.